For measuring finger range motion, we're going to use the small goniometer that you've cut down. Same one that used as the wrist, we're just making it smaller. When we measure, we look at extension and flexion. So with extension, you're gonna have your patient or your client straighten their fingers as far as they can. With extension, we start at 0 and we increase the number for flexion. So we're gonna measure, if we can, on the dorsal side of the hand. And actually he's a little bit past 0, so he's at like a +5. This one's a 0, and there's a 0. So you're gonna measure all along the MP joint, the PIP joint, and the DIP joint to assess extension. You're gonna measure all the way across, index through small finger, and all the way up. Now for flexion, go ahead and flex your fingers, make a fist.
Yeah.
Keep your thumb over here, Good. For flexion, once again, we started at 0, so we're gonna increase our angle. And as we look at this, he's got about 75 degrees of flexion here. And then we're gonna measure the PIP joint, which is about 95 degrees. And then we turn it around this way to use the smaller corner for our angle. And we're about 70 degrees there. And then we would go and measure the middle finger, coming over top, and over top. You can measure each joint individually or a composite fist to assess the length of the muscles along the extensor side.